Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we are going to discuss about the third generation intrauterine device, that is the hormone containing intrauterine devices. So in the previous module, we discussed about the first and the second generation IUDs. So similar to the first and the second generation IUD, even this third generation IUDs are long-acting contraceptive methods, right? So what do you mean by long-acting contraceptive method? See, there might be certain intending couples who do not want any further conception at all, but then they are refusing permanent methods of sterilization such as the tubectomy. So in those intending couples who do not desire any further conception, but at the same time they are refusing the permanent method of sterilization, what are the choices which are available to you? So as a clinician, you have to get to their point that you need to prescribe a contraceptive which is going to be long acting as well. So why it should be long acting? Because once an intrauterine device is inserted inside the uterine cavity, now it is effective for the next 5 to 7 years, right? So only after 5 years or say, you have to just renew this contraceptive, by which you're going to remove the contraceptive device, you throw it, and you're going to insert a new contraceptive device inside the uterine cavity of the female if they are again willing for birth spacing even after 5 years of usage. So in all those intending couples who do not desire any further conception or who want a longer period of birth spacing, the ideal contraceptive which can be prescribed to them are this longer acting intrauterine contraceptive devices. And it comes with an advantage that it is reversible contraceptive as well. So what is a reversible contraceptive? A reversible contraceptive is one after discontinuation or after removal of the intrauterine device, the return of the fertility of these intending couple has to be very quick. So this IUD comes with an advantage that it is a reversible contraceptive. That is, after removing this intrauterine device from the uterine cavity of the female, the return of fertility is going to be very quick. So ideally, these IUDs are safe, effective method of contraception, longer acting contraception, and therefore they are reversible method of contraception as well, right? Fine. So now our discussion is going to be entirely restricted to MIRENA, that is third generation IUD. So MIRENA is a third generation IUD and therefore it is a hormone containing IUD. So third generation is all about hormone containing intrauterine device. So first generation is a non-medicated flexible small device, that is the Lippes loop, and the second generation is copper containing intrauterine devices, and the third generation is hormone containing intrauterine devices, right? So under hormone containing intrauterine device we have two things. One is this MIRENA and the second one is a progestasert. But you need not learn much about this progestasert, you need to learn only about the MIRENA, right? So MIRENA is a device which is a intrauterine contraceptive device which contains a hormone. And what is that hormone? It is going to contain the hormone progesterone in it. And which generation of progesterone is present in this device? It is the second generation progesterone which is contained in this intrauterine device. So what is that second generation? It is the levonorgestrel. So levonorgestrel is a second generation IU progesterone, and this second generation progesterone levonorgestrel is ideally contained in this intrauterine device MIRENA. Clear? So therefore it is called as LNG IUD. So what is LNG? LNG stands for levonorgestrel intrauterine device, which is called as MIRENA, right? Now the next question which comes to your mind is how much of levonorgestrel is present in this device? It is about 52 milligrams of levonorgestrel second generation progesterone is present in this device. Okay, so 52 milligrams of levonorgestrel is present in this device. So once you're going to insert this intrauterine device inside the uterine cavity of the female, it is going to release certain amount of progesterone every single day. So it is going to release about 20 micrograms of levonorgestrel every day. So every day this IUD is going to release about 20 microgram of levonorgestrel every single day. And once this device is inserted inside the uterine cavity of the female, it is approved to be effective for next 5 years, but then it can be used until 7 years. So it has been approved for only 5 years, but then it is also said that it's effective for the next 7 years from the time of insertion. So for the next 5 to 7 years, you need not worry about anything. So only after 5 to 7 years, you have to renew this contraceptive method. So therefore, it is a longer acting reversible contraceptive method. Is that clear? Yes. So the approved time span, that is the approved lifespan for this IUD MIRENA, is about 5 years. Clear? Yes. So coming to the failure rate of this IUD. So the failure rate is only about 0 to 3 per 100 women years. So out of 100 women who have used this device as a longer acting contraceptive, only 0 to 3 women have conceived out of this method. So the failure rate is also very less with proper usage of this intrauterine devices, right? Fine. Now, what about the chances of ectopic pregnancy and the risk of pelvic inflammatory disease? So, in order to get the answer for this question, you need to learn the basics of this IUD. So, levonorgestrel IUD is basically a third generation IUD, which is a hormone containing IUD, right? And what is that hormone? It is the hormone progesterone. And which generation of progesterone it is? It is the it is the second generation progesterone, that is the levonorgestrel. It is, there might be a confusion here. The generation of IUD is a third generation, but the generation of progesterone is a second generation progesterone, that is levonorgestrel. So progesterone basically has a smooth muscle relaxant effect. Progesterone has a smooth muscle relaxant effect. We always know that fertilization occurs in the fallopian tube, right? Fertilization occurs in the fallopian tube. And in the fallopian tube, after fertilization occurs, there is going to be formation of zygote. So once the zygote has formed inside the fallopian tube, by the smooth muscle contractile effect of the fallopian tube, assisted by the ciliary motility of the fallopian tube by the cilia which are present in the fallopian tube, this zygote is going to eventually move from the fallopian tube and it is going to be implanted inside the uterine endometrium, right? So the zygote is going to become blastocyst and it is getting implanted in the uterine endometrium. So what are the two important factors which are very important for the implantation? So it is the smooth muscle contractile effect of the fallopian tube and the ciliary motility of the cilia which are present in the fallopian tube. Just before now, I told you that progesterone has a smooth muscle relaxant effect. But for the implantation of the blastocyst in the endometrium, the zygote has to eventually migrate from the fallopian tube. And for this migration of the zygote, the smooth muscle contractile effect is required, right? In case of failure of this intrauterine device, what is going to happen is the smooth muscle contractile effect is going to be lost. Why? Because progesterone is present in this female and progesterone has a smooth muscle relaxant effect. So it is going to cause smooth muscle relaxant effect in the fallopian tube, and due to the absence of migration of the zygote for implantation of blastocyst in the endometrium, this zygote as a blastocyst is going to implant itself in the fallopian tube and it is going to grow in the fallopian tube itself, which is known as the ectopic pregnancy. So the chances of ectopic pregnancy with IUD MIRENA is increased when compared to the copper T. So third generation IUD, which is the progesterone containing IUD, has a higher risk of ectopic pregnancy when compared to the copper T. Is that clear? Yes, as you can see here, I have mentioned progesterone is going to decrease the ciliary motility and it is going to cause smooth muscle relaxation effect. So there are increased chances for the zygote to lodge and implant in the fallopian tube itself and grow there. If the implantation is going to occur in the fallopian tube and if it is going to grow in the fallopian tube itself, it is called as ectopic pregnancy, because ectopic pregnancy is implantation at any other site other than the uterine endometrium, right? So there are increased chances of ectopic pregnancy. Is that clear now? Yes. So the chances of ectopic pregnancy with respect to IUD MIRENA is ideally increased when compared to the copper T. Clear? Yes. Now, the most common side effect or the most common complication of IUD insertion is bleeding. So similar to the copper T and IUD MIRENA, the most common side effect of IUD insertion is bleeding, right? It is bleeding. But then when compared between the copper T and MIRENA, which has the highest rate of bleeding and which has the next rate of bleeding. So the highest rate of bleeding among the copper T and MIRENA is about to copper T. So copper T has a little bit higher risk of bleeding when compared to MIRENA. It doesn't mean that MIRENA doesn't have any bleeding. No, it is not like that. Both copper T and MIRENA exhibit some bleeding after the insertion. But then when compared to the MIRENA, copper T has a little bit of higher risk of bleeding when compared to the MIRENA. So chances of ectopic pregnancy is increased in MIRENA when compared to copper T. But then the chances of ectopic pregnancy is present for both these IUDs. But it is little bit higher for MIRENA when compared to copper T. But at the same time, the chances of bleeding after the insertion is present for both the copper T and MIRENA. But then it is slightly higher for copper T when compared to the MIRENA. So if in the option they have given which among the following has the most common side effect as bleeding, it has to be copper T followed by MIRENA. Clear? Yes. And now, what about the risk of pelvic inflammatory diseases? The chances of pelvic inflammatory disease with respect to copper T is present, but then it is a less chances of pelvic inflammatory disease when compared to MIRENA, right? So the risk is present, but it is very less when compared to MIRENA. But what about MIRENA? MIRENA has no risk of pelvic inflammatory disease. See, with respect to copper T and MIRENA, the risk of pelvic inflammatory disease is no in MIRENA, and the risk is present, but the risk is very less in copper T. So with respect to copper T, the risk is present, but it is very less. But with respect to MIRENA, there is no risk of pelvic inflammatory disease. Now you may have a doubt that why there is no risk of pelvic inflammatory disease with respect to MIRENA. It is because, see, in copper T, the main mechanism is that the copper is going to induce a sterile inflammatory reaction, right? Other than that, it is not going to prevent any transmission, or it is not going to prevent any ascent of infections. So therefore, the risk of pelvic inflammatory disease is present even though it is inserted in a very sterile precaution. But then with respect to MIRENA, there is no risk of pelvic inflammatory disease. Why? Because as that we know that the hormone progesterone, that is the second generation progesterone, levonorgestrel, is contained in the device. Progesterone is known to have increased the thickness of the cervical mucus. So the cervical mucus is going to be thickened under the influence of progesterone. So if the cervical mucus is going to thicken, it is going to act as a cervical cap, and this thickened cervical mucus, which is acting as a cervical cap covering the cervix, this is going to prevent the ascent of any infections. So as it is going to prevent the ascent of any infections, therefore the chances of pelvic inflammatory disease is nil. So there is no risk of PID with respect to MIRENA. But in copper T, the risk is present, but then the risk is very less, right? Great. Now, what are the techniques of insertion of this intrauterine devices? So, with respect to techniques of insertion, we will have a separate module under which we will discuss in detail about how this copper T and IUD has to be inserted under sterile precautions. But then as of now, you need to learn the technique, that is the no touch method. So, if you are not going to touch the device at all, then the chances of transmission of any infections from your hand to the device is very less. So no touch method is one of the method, and withdrawal method. So no touch method and withdrawal methods are the techniques of insertion of this intrauterine devices. Now the next most important question which comes to your mind is, what is the period of insertion? So when can these devices be inserted? So let us divide this into two categories. So one category is after the delivery of the fetus, and the second category is that in a non-pregnant female. So the first category is a pregnant female after delivery of the fetus. The second category is a non-pregnant female. So in a pregnant female, after delivery of the fetus in that female, when can this device be inserted? So there are three possibilities which are provided to us. One is post-placental insertion, second is postpartum insertion, and the third is interval insertion. What do you mean by post-placental, postpartum, and interval insertion? Post-placental insertion is when you are going to introduce this intrauterine device inside the uterine cavity of the female within 10 minutes of delivery of the fetus. So immediately after delivering the fetus, within 10 minutes of delivery of the fetus, if you're going to introduce this intrauterine device inside the uterine cavity of the female, it is termed as post-placental insertion. So after the delivery of the fetus, you will eventually deliver the placenta as well, right? So after the delivery of the fetus, within 10 minutes, if you insert the device, it is called as post-placental insertion. And what about the postpartum insertion? Postpartum insertion is when more than 10 minutes from the delivery of the fetus have passed. But after 10 minutes, but within 48 hours after the delivery of the fetus, if you are going to insert this intrauterine device inside the uterine cavity of the female, it is called as postpartum insertion of IUD. And what do you mean by interval insertion? So interval insertion is when 6 weeks have passed after the delivery of the fetus. So 6 weeks post delivery of the fetus, if you are going to insert this intrauterine device inside the female's uterine cavity, it is called as interval insertion. Interval insertion is indicated because after the delivery of the fetus, for the next 6 weeks, the uterus and the organs will go physiological involution, right? It will go back to its normal size. So during those period, you cannot insert the intrauterine devices inside the uterine cavity because it has to be ensured that it is properly inserted inside the uterus for it to be very effective, and you need to reduce the failure rate as well as you need to reduce the rate of expulsion of these devices. So in order to decrease the failure rate, either it has to be inserted after delivery of the fetus within 10 minutes. If you fail to insert within 10 minutes, you can do within 48 hours after the delivery of the fetus. If you have failed to insert this IUD within 48 hours, then you need to do intervals method of IUD insertion, that is after 6 weeks of delivery, you need to plan for interval insertion of intrauterine devices. Okay, so this is after delivery of the fetus. Now coming to the second category. So second category is when you are going to insert in a non-pregnant female. So in a non-pregnant female, when it can be inserted. So in a non-pregnant female, ideally it can be inserted at any time. But then if you are going to introduce it during the proliferative phase, it is well and good. But if you are going to introduce the IUD in the luteal phase of the cycle, luteal phase means that ovulation has occurred. So since ovulation has occurred, the chances of pregnancy are also present after the ovulation. So therefore, during the luteal phase, if you are going to introduce this device, in order to increase the effectiveness of this device, you need to adopt some barrier methods of contraception along with this device. But then the best time to insert this intrauterine device in a non-pregnant female is during menstruation, because all of us know it is very common that if a female is going to menstruate, it is very well known fact that there is no conception, that is the female is not pregnant at all. So pregnancy can be ruled out if she is going to menstruate. So during menstruation, you can insert this intrauterine device inside the uterine cavity of the female. Is that clear? Along with that, you also have the advantage of ease of insertion of this device during menstruation, and along with that, the second most important fact is that pregnancy can be ruled out in a female who is menstruating. Right? So this is the period of insertion with respect to intrauterine devices. So we have discussed everything in detail about IUD. Now, what are the indications where IUD MIRENA can be inserted? See, IUD MIRENA is all about progesterone, right? IUD MIRENA is all about progesterone. Progesterone has anti-proliferative action on the endometrium. So therefore, this can be used in females with complaints of heavy menstrual bleeding, right? In females who complain of dysmenorrhea, painful menstruation. In those females, if you are going to stop the menstruation, there is no dysmenorrhea. So any females with complaints of heavy menstrual bleeding, complaints of dysmenorrhea, you can prescribe this IUD progesterone. Why? Because progesterone is going to exert support to the endometrium, and unless and until the progesterone level is going to fall, there is no menstruation at all. So since the progesterone is going to support the endometrium, there is no menstruation. If there is no menstruation, there is no pain, there is no heavy menstrual bleeding. So any females with complaints of heavy menstrual bleeding, complaints of dysmenorrhea, and those females with endometrial hyperplasia without atypia, you can also insert this intrauterine device, right? And for those females who want a longer method of contraception, but they don't want a permanent contraceptive method, in those females also you can insert this. And it also has the advantage that post-abortive insertion is also possible with respect to intrauterine device MIRENA. So post-abortive insertion, that is after first trimester post-abortive insertion, is possible with MIRENA. So immediately after the abortion, all the first trimester abortions, immediately after the first trimester abortions, IUD MIRENA can be inserted. Why? Because is that in first trimester, right, you cannot expect the uterus to enlarge much, right? The hypertrophy of the uterus is very less when compared to the other trimesters in first trimester. So therefore, the uterus is going to be in its normal physiological size and shape. So after first trimester abortions, this intrauterine device can be inserted inside the uterine cavity. And also, this IUD MIRENA is safe for nursing females as well. Who are nursing females? So all the breastfeeding females, IUD MIRENA can be inserted as well. Clear? So intrauterine device MIRENA has so much of advantages. One among those is all these which we have discussed until now. Is that clear? So we have discussed everything in detail about the first, second and the third generation of intrauterine devices. So in the next subsequent module, we will learn about what are the techniques and methods of insertion of intrauterine device, and what are the contraindications and what are the indications as well in the subsequent modules. If you haven't subscribed to Mackler, you please subscribe to Mackler for daily video module updates, and just don't forget to revise and study, because every single topic which you are discussing in Mackler is very important, right?